All right, Dr. we're just going to jump right into it. I'd like us maybe to start off by you giving us an overview of how Red Cross is handling the COVID-19 pandemic.
Okay, thank you, Nina. As an organization, we have been involved since the beginning of this pandemic. Actually, before Kenya announced its first case, looking at what was happening globally, we started to prepare. So we started by training our staff and volunteers to ensure that in the event that it became a reality in Kenya, we would be well prepared to sensitize communities. We are involved in community sensitization in all the 47 counties where we are present. We are also supporting the Ministry of Health in terms of mental health and psychosocial support. We have a toll-free line, 1199, which anyone could call if they need any psychosocial support or if they need to be referred even for further guidance. We are also involved in distributing of hand washing facilities, especially in the informal settlements, and also the big question about food, because we know that with COVID-19 as well, food has become a big issue. So we are working with the government, but also with other partners to ensure that the most vulnerable in our communities continue to receive food during this time.
I'm sure it's not a very smooth ride, Dr. So what challenges are you facing?
There are many challenges, Nina. I think one of the big ones, of course, is the issue of resources, because this is a problem that is affecting the whole country. And therefore, to be able to reach every part of the country and to reach every Kenyan with the correct message and correct information, and also supporting our healthcare workers, need quite a bit of resourcing. As the Red Cross, most of our support usually comes from other sister Red Cross societies globally. But you can imagine today with COVID-19, they are even the worst affected. So of course, it becomes a challenge. But more importantly, I would say one of the biggest challenges that keeps us awake is the fear of risking transmission for our first responders. Because when they are out there, they are also putting themselves at risk, and therefore we have to ensure that they're protected. So this is very different from when we responded to other disasters. We have to be careful that we do not also put them at risk, and we also do not risk the communities that we are also serving.
Now, just to finalize on this COVID-19 so that we can jump into Martyrs floods, how is the Red Cross Society working with the COVID-19 fund currently?
With the COVID-19 fund, we are coordinating mainly on the food issue. Because then we have different partners, organizations that come forward and want to distribute food and want us to support them. So we ensure we coordinate with the emergency fund. We give them the information in terms of what we are receiving and where we are taking the food, so that there is no duplication with other partners.
Okay, now, Dr. we are now also facing floods that are in various parts of the country. Could you kindly give us details on the current situation, areas affected, fatalities, and maybe the number of people that have been displaced thus far?
Yes. This is again a big complication on top of the COVID-19 pandemic. This time, I think we've seen areas in this country that had not been affected in the past few years that have been affected. So we are talking about floods in the whole country, but mainly 35 counties out of 47 counties have been affected. And many of them are affected to different degrees, but the most affected is Western Kenya, that is Nyanza and West Kenya. So looking at counties like Kisumu, Homa Bay, Migori, Busia, and then moving on to the northeastern part of the country. So we have Garissa now, Mandera, very much affected, and then moving down to the coast, where Tana River, I would say, is probably the worst hit. So this is a problem today we can say has affected more than 27,000 households. If you multiply that by 5, then you're talking about almost 126,000 people. But these numbers are yet to increase actually, because in the next few days we still expect the rains to continue, and we still expect, especially in the coast, that other counties like Kilifi will also be affected. So this is the situation we have at the moment. We have also livestock that have been washed away. We have farmlands that have been washed away. So I think there are many challenges, and looking forward, food security will become a big issue. And not to talk about another disaster, which is the locust invasion, which we are also looking at and trying to see how we can mitigate its impact.
Right. And what about the fatalities?
So far, from the government perspective, and I think the government has announced more than 200 people that have lost their lives. But remember, we also have maybe another 20 people that were still missing, especially from the landslides in West Pokot and Elgeyo Marakwet. So I think a lot of the information as well is still part of what we are trying to assess in some of the other counties to really understand the magnitude here.
All right, 200 is a massive number considering right now we are battling the coronavirus, Dr. Someone would assume the coronavirus would have hit harder than the floods. Yes. So what are the emergency response measures that have been implemented thus far?
For floods, one of the key issues for us has been search and rescue, because you can imagine some parts of the country have been marooned. So we've had to evacuate people from some of those villages. Shelter has been a big issue because many people have lost their homes. So we've had to give them temporary shelter. Many of them have been actually put in camps. To date, we are talking about 164 camps all over the country. Majority, almost, I would say, 116 of them being in the western part of the country. So this has been a big issue, and it will be a big issue even after, because for those that have had their houses destroyed, will need support to rebuild. So that's a big issue. And then, of course, medical care is also another challenge. You can imagine now with a lot of water, not clean water as well, the risk of waterborne diseases, but also the fact that people cannot even reach to the health facilities for treatment of some of the other ailments. This is also a big problem, and we are trying to provide some mobile clinics, be able to reach people where they are, just to ensure that we can help to deal with some of the common ailments.
And as we slowly wind up, Dr. we somehow find ourselves in this same position year in, year out when it comes to Martyrs floods. What mitigation measures would you advise moving forward?
I think what is important is that we need to look at a long-term solution. What we can see with these floods today, for example, most of it has also been as a result of the rivers. The rivers that have swollen beyond their capacity, the dams have swollen beyond their capacity and have caused this destruction. So we need to look at what is it about these rivers. Is it that there's been so much silt now in the river that any additional water comes in and has no space? So it may mean we need to desilt these rivers. We may need to look at the course of the rivers, because we also know that maybe we've built also on the path of some of these rivers in the past because there was no water. So we need to be able to ensure it can take its natural course. The Lake Victoria has also been a big problem this time, because there's been a backflow from the lake to the communities that are living around the lake, and there are some measures that need to be taken. Building of dams along these rivers as well is another solution, because a lot of water is just flowing down, and this is water that can be harvested to help with any other economic measures. So I think we need to really reflect and look at these long-term solutions to reduce this perennial impact.
Right, and finally, Dr. I just want to hear your thoughts, or rather, where does a Red Cross Society stand when it comes to the locust invasion?
Yes, we're actually just preparing. Tomorrow we'll be launching an assessment, working with the Food Agricultural Organization and the Ministry of Agriculture, to actually start to do assessments to see what is the impact in some of the counties that have already been affected. But we are involved in surveillance. because we are on the ground, and more importantly, now reflecting on the measures to take. Because, like I said earlier, if you put COVID, put floods, and put the locust invasion, food insecurity will be with us for some time. So, what do we need to do now to ensure that no Kenyan actually goes hungry because of these disasters?
All right. Well, thank you so much for giving us your time, Dr. Asha Mohammed. I really do appreciate you. I guess we'll be chatting real soon as we continue to fight this pandemic, as we continue to fight the floods, as we continue to even fight the locusts. There's so much going on. We'll definitely need you to speak to us again.
Thank you very much also for having me, and we look forward to more discussions. Thank you.
Sorry. Have a lovely afternoon.
You too. Bye.